Did you know that cancer is preventable? But what really causes cancer? How can one prevent cancer? Join John Gaho on My Health, My Gold, as he expounds on probable causes and prevention of cancer with professional medics. Indeed, My Health is My Gold, only on Mother and Child TV.
Hello viewers, and welcome to Mother and Child TV. This is your program, the first episode of My Health, My Gold. Yani kwa Kiswahili tutasema afya yangu dhahabu yangu. As you understand, in Kenya, and not only in Kenya but in the whole world, we have so many diseases which are revolving around the human being. And as Mother and Child TV, we thought about bringing to you practitioners so that they can be explaining to you each and every disease. Maybe if a disease has prevention, if a disease has cure, you're going to be getting all this information from the medics, those people who are trained in that field of medicine. And today we are going to discuss about cancer. If you can look around, so many Kenyans have been affected by cancer. You might find that a person has a certain type of a cancer, another person has a certain type of cancer. Would like to know what is this that causes cancer? How can this cancer, if it's a certain type of a cancer, how can it be prevented? And with us in the studio, we have Dr. Mbuya.
Hello.
Welcome, Dr. Mbuya. Yeah. I'd like you to introduce yourself to my viewer. Tell the viewer who you are, where you come from, what you do, what is your area of practice.
Yeah, thank you. My name is Dr. Mbuya Leonard. I am a medical doctor, a general practitioner, and also I teach in the university.
Okay. When you talk about a general practitioner, you said that you're a general practitioner. Yeah. What did you mean by a general practitioner?
A general practitioner is one who is not practicing in a particular line of specialization. So you tend to attend to the young, children, mothers, men, the elderly.
Yeah.
So the kind of service I offer cuts across.
All genders.
Yeah.
That is, be it women, be it men, be it all, be it young.
Yeah.
Okay. Now, Daktari, the topic of today, the reason as why we invited you to Mother and Child TV studios is we want you to give our viewer all information that you might be having and that you might have researched about a disease that is cancer, which is mostly affecting Kenyans. Now, I'd like you to start by telling us, what is cancer?
Cancer is a disease that affects cell growth in our bodies.
Okay.
Something wrong happens, a problem with cell signaling, such that our cells start growing uncontrollably, so that we have excess mass of cells growing at a particular part of the body.
Okay.
Yeah. So, under normal circumstances, cell growth is a tightly controlled process. Yeah. There is some type of cell signaling that allows some cells to multiply at a particular time. At other times, the process is shut down.
Yeah.
So when something wrong happens and the process is uncontrolled, that's when we have excess cells being produced and accumulating, resulting in the formation of a lump or a mass. Yes.
A lump or a mass.
Yes.
So when you see something starting growing, maybe it is not normal, so that might be one of the symptoms of cancer.
Yes. An unusual growth.
Unusual growth.
Is one of the signs of cancer.
Now, before we continue, I'd like you to tell me, when you look at our nation, do we have a large number of people who have been affected by cancer?
Yes, cancer is a big problem now. As to whether the incidence of cancer is increasing or not, I think that is something that is debatable. Because probably we used not to pick these cases of cancer before.
Yeah.
Maybe we did not have the equipment to do the diagnosis, or we were saying maybe our people were dying of witchcraft.
Yeah. Of dying of witchcraft.
Yeah, but of course now with better diagnostic services available and within the reach of the common mwananchi, we are able to pick these cases at an early stage. So probably we are able to pick more cancers now. That's why we have more cases of cancers being reported. But of course, a problem in our country is that we do not have adequate data on cancer. So most of what we are talking about is based on the data that has been collected in the recent past. In the recent past, a few years ago up to now, because now at least we have a cancer registry, which it used to be there, but it used not to be very active. So of course we had a problem with the data. We could not really know how common cancer was. Or the magnitude of that problem. But at least now we have a good idea on the extent of cancer in this country.
And if I can ask you, what is this that is making you as doctors not to have that data that you might be willing to have in your system? Or maybe in your files?
Well, when it comes to data management, it's more than just having a file. Because you can have the data in the patient file. But how can that data be summarized and stored somewhere? And cancer is actually a national thing. You're not saying that data only in a small health facility. So the aspect of collecting data from various health facilities, bringing to a central registry so that we can have a general idea on the magnitude of the cancer burden in the country. So there was a disconnect between the health facilities and our main referral hospitals. Two, also unavailability of equipment to aid in cancer diagnosis. Three, also the human resource aspect. How many people in this country, how many doctors in this country have been specialized in cancer? How many oncologists, we call them oncologists. Have done training or have taken a specialization in this area. So cancer management is an emerging area. And I know the government has been doing a lot. In the recent past, we have read over the media, the government putting equipment in the county hospitals to aid in cancer diagnosis and management.
Now, when you talk about having not collected, data having not been collected from those dispensaries, then linked to the national, maybe to the national system, does it mean that we might be having data in those local hospitals and maybe the cases are not reported in the national system?
Yeah, it is true, because most what we call the Wanjikos, they do not come to Kenyatta National Hospital. They do not go to the provincial hospitals. They go to our dispensaries. They go to our health centers. They go to the district hospitals. In fact, most of them end up at the district hospital level, what we call level 4. So these are the primary facilities. So actually they are the filter facilities that the patient report to fast. So when cancer is picked up at that level very early, we are likely to have a better outcome, because the patient is likely to be started on treatment early. At least the patient will be referred to a facility where we have the specialists in good time, and the patient is likely to be started on treatment early. Remember, there is no disease that starts big. All disease conditions start small. It is a delay in diagnosis that is making us having patients with cancer being seen
When you talk about,
towards the
if I
end.
cut you short because I want my viewer to understand. When you talk about delay in diagnosis, you are a specialist in that field. I'd like you to elaborate. When you talk about delay in diagnosis, what do you mean by diagnosis?
One delay in diagnosis, when you talk about the concept of delay in diagnosis, it's a complex issue because there are factors touching on the patient. There are also factors touching on the healthcare system.
Yeah.
And also the referral system. When I suspect cancer,
Yeah.
how do I refer this patient to the next
Now
level?
you as the doctor.
Yes, me
When
as
you
the doctor
suspect
at the
that a
health
patient-
facility. Is there a system in place where I can, at the health center level, I come across a patient who I suspect could be having cancer. How do I refer this patient to the next hospital and to who?
Yeah, and to who?
Yeah. So two is it has to do with our health-seeking behavior. When I notice something unusual in me, how long does it take for me to seek care,
Medication.
to get to understand what the problem is? In our country, at least women are gender, health-seeking behavior has to do with the gender. Women are usually seek care much faster
Than men.
than men. Yeah, because for men they want to try self-medication. They want to buy.
I'm not understanding. Do you mean that women are most likely going to visit hospitals than men?
Yeah. Visit our hospitals today. Most of the patients you see there are women and children.
And what
not
might
men.
be the cause of this?
Well, I think it has to do with men think they know. Also, I think it takes time before men ask for advice or seek to understand what is this that could be disturbing them. But most men, by the time they come to the hospital, they have tried many other things. Either they have tried the traditional healer or they have tried self-medication,
After feeling some pain, they
most of the time, by the time they come to the hospital.
We are men. Remember we are men.
Yeah, it's true. And of course, some of the things that we struggle with. Most of the time, men are not very quick in asking for advice. Women are rather free with each other and they discuss their issues freely. And in the course of the discussion, they are likely to hear of another person who had a similar problem and how they were helped. So information flows freely among women than men. Most times men put on a brave face when they are really suffering. By the time they are coming to the facility, sometimes it's a bit late.
Wow. Hey, my viewer. You are there as a man. You can hear the challenge that our specialist here, that is Dr. Mbuya, is saying. He is telling us that most men, that is us, we don't seek for medication first. Maybe you're there, you might be feeling that, there is a problem somewhere with my body. Something that is not normal is happening to my body. And you're a man, not even a man. Even you are there, you're a woman. And you are saying, I'll take this kind of medicine so that I can see whether the pain shall go down. So Dr. is saying that soon you should see a specialist as soon as possible. And now if we can continue, Dr. You've talked about the system, the way of the government, the data is collected about cancer cases. And you've talked about lacking that connection from the local hospitals to the national hospital.
Probably I may not say that the system is lacking, but is the system functional?
Yeah, functional.
Is there a well-defined system?
So the system is there.
The system is there. There is a national referral policy in this country by the Ministry of Health. The system is there. The government has done its part. But how are we using that system? Have the facilities put in place structures for referral of cancer patient? That is my question.
Yeah.
Yeah.
And
so the government has put a policy. We have a national referral policy in this country.
Yeah.
But I think we need to strengthen that system. We need to strengthen. Because I may be at the health center and I may refer a patient to probably to level 5
level 5
hospital where we may have these specialists. But how long will it take for this patient to be seen by the cancer specialist?
By the cancer specialist?
Yeah.
Now, it's like you mean that we don't have enough cancer specialists in Kenya?
Yeah, we the truth is that we do not have cancer specialists. One, the area of cancer is an area that has generated a lot of interest in the recent past. Partly because maybe it was not an area that much was known about. But right now, you and me are aware that there's been a lot of interest, in this area. So we are likely to start having people, either the government sponsoring people to go for further studies in this area, and even self-sponsored people who have an interest in cancer and cancer management.
Okay, that's good. That's good. If we have some people who have started maybe getting into universities and doing a course that is going to lead this person being a specialist in cancer treatment. Daktari, there might be a viewer there who might be having a question, and if I can look at our social page, there is a person from Wangige, and the person is asking, Daktari, do we have types of cancers? And if they are there, can you please assist us by knowing what are these types of cancers that might be existing amongst us?
Yeah, we have several types of cancer. When we want to talk about the type of cancer, maybe we may want to look at the cell type, which type of cell in the body, because in the body we have different types of cells. So we may want to talk about the type of cancer based on the cell type, that is or based on where which part of the body is affected.
Okay.
Probably it is easier in such a forum to talk about cancer based on the part of the body that is affected, because most of the time when we hear about cancer, we don't get to know about the cell type. We only get to hear maybe cancer of the skin, cancer of the breast, cancer of the cervix, cancer of the prostate.
Now, you've talked about some types of cancer, like the cancer of the skin. Recently, I heard that there is still cancer of the eye.
Yes.
I heard that there is cancer of the hair. I don't know whether it is true or false, and that is why I've called you as a specialist, so that you can explain. I heard that still there is cancer of blood.
Yes, cancer of the blood, leukemia,
Yeah.
multiple myeloma.
Yeah. Now, for today, I want us to discuss one type of cancer so that we can keep on discussing each and every type. Now, you've talked about one type of cancer which is affecting so many Kenyans. And as you've said, so many men are not seeking for medication. And currently, we have this type of cancer that is known as the prostate cancer.
Yes.
What is prostate cancer? If you can say it in layman's terms,
probably cancer? Before we talk about prostate cancer, we need to talk about the prostate.
The prostate.
The prostate is one of the glands in the male reproductive system that play a role in reproduction. And this prostate gland, it's situated around the urethra. The passage that passes urine. So with age, the prostate enlarges or increases in size. And it undergoes what in medical terms we call hyperplasia.
Do you mean that what you're calling the prostate is the section, that path where urine passes through?
Not exactly. The path through which urine passes is the urethra.
That is the urethra.
Now the prostate gland encircles the urethra.
Okay.
It encircles the urethra. It's one of the glands that produces secretions to semen, to make up semen.
Okay.
Yeah. So this gland, with age, it increases in size. It undergoes what we call hyperplasia. Hyperplasia. That's the number of cells increase.
Oh, they increase.
Yeah, the number of cells increase. So during these changes, an abnormal or uncontrolled cell growth can occur. Yeah.
Okay.
Yeah, and this tends to happen from mostly to be seen from the fourth decade of life.
That is from the age of 40?
Yeah. Actually, for all men from 40 years and above should do screening.
Screening of cancer.
Yeah, for prostate cancer.
That is prostate.
Yeah.
So you are actually calling that man who is there, and maybe he is 40 or maybe and above, to go for a screening of prostate cancer.
Yeah, it is actually recommended that all men 40 years and above should go for cancer screening. And the good thing is that these services are now readily available. In most of the hospitals, we have what we call prostatic specific antigen test, whose results can come out within 30 minutes or so.
You visit a medical facility,
Yeah,
you get your cancer test
ask for PSA, PSA titer levels, and they take your blood, and your blood, the test is done, and within a few minutes, 30 minutes to 1 hour, your results are out.
Yeah, and you've mentioned about cancer of the prostate.
Yes.
Affecting the men who are age of 40 and above.
From 40 years and
Can we
above.
have a case whereby maybe a person who is below 40 being affected by prostate cancer?
Well, in life there are no impossibilities. Well, I have not come across data of somebody under 40 years with prostate cancer. But in other types of cancer, like cancer of the cervix, we used to say it was for elderly women.
Yeah.
But today, we have even women, ladies, 20 years between the age bracket 20 to 30 today,
20 to
who
30.
are presenting with cancer of the cervix. So, with better data management, we are likely to pick such cases.
In such cases.
Yeah, because remember that the cause for cancer is not known. Exactly what happens, the cause behind cancer is not known.
It's not known.
But we have some associated factors.
I'd like to remind my viewer there that if you have any question or any comment that you'd like to, maybe you want to ask a question to Dr. Maybe you want to send a comment to us, just use the numbers on your screen, and your question or your comment will reach us right where we are. Now, Dr. if I come back to you, you've talked about factors that might lead to a person having cancer. What are some of these factors? And more so, I want us to discuss about prostate cancer, because it is our most topic of the day that we have started discussing in this first episode.
One of the predisposing factors, of course, is age. As we had said earlier, 40 years and above. That one is a risk factor.
Age.
Age is a risk factor because of some of the changes the body, as we grow older, our body undergoes some changes, what we call degenerative changes. So even our cells also undergo some changes. Some of the changes that we go through maybe lead to the process of cancer formation. There's been a lot of talk on our diet, lifestyle, and also our diet.
The way we eat.
We've moved away from, we've taken a direction of taking a lot of synthetic or refined foods.
Refined food.
Yeah, so diet also has contributes.
No.
Because
you talked about refined food, Dr. And you've made me to start thinking about something. Do you mean that the food you are taking might be one of the causes or the factor that is leading to people getting cancer?
But some of the foodstuffs, they are processed and they are stored. Some of the processed foods, which have to be canned, remember we have to use chemical, to food preservatives. And also maybe we are putting them in a metallic tin. And there may be some reaction. So some of these things, when like maybe when you take fish that has been in that tin for the last 2 years, I mean, there definitely have been some reaction between the metallic part and the stew.
The stew.
Also the chemicals, the food preservatives, which essentially are chemicals. They've been accused of playing a role in cancer causation. Yes.
Okay. If I would,
of course, other factors are things like exposure to irradiation.
Irradiation.
Irradiation, like where there's been a lot of volcanic activity and we have a lot of irradiation from stones, or even exposure to
the sun rays.
Sun rays, the ultraviolet rays also have been implicated. Sedentary lifestyle, it may not necessarily, it does not play a direct role in cancer causation, but a sedentary lifestyle brings about things like can predispose you to development of obesity and diabetes, hypertension, which all this affects the body metabolism. When we talk about the body metabolism, we're talking about cellular processes. So these cellular processes can become disordered, thereby resulting into formation of cancer.
Okay, we are talking about prostate cancer, and there is a man here. I won't say where he comes from, and the man is saying, "Hey, Doctor, I'm feeling some pain under my urethra, and the pain follows some itching. What might be the problem? Might that be a symptom of cancer?"
Well,
I think the person is so much scared when he heard about what you say.
Pain, the pain depends whether the pain comes when passing urine or is the pain there throughout. I must say that pain, with pain in cancer, pain tends to be seen in advanced cases.
So the person won't
usually with cancer, the initial stages, usually there is no pain.
So you're just feeling
there may be a lump or a mass, which is characteristically it is usually painless. So those masses or lumps that are usually initially painless, we don't have to underrate them.
Okay.
It is good to get to understand what that mass is.
So you start growing something but you're not feeling
a lump. Because of excess cell growth. Definitely results in a mass or what we call a lump. Typically that lump is initially painless. Pain tends to come later.
Okay. Another person is asking, Dr. how can I know whether I have prostate cancer? Is there a symptom that this person can be able to detect, so that the person can know?
Most of the time, by the time we start getting the symptoms, the disease is advanced.
So what kind of advice can you give to this person?
The best advice is to go for cancer screening.
Cancer screening.
Cancer screening. Cancer screening. Yes.
Okay. I'll ask you some other question. Let me look at social page. Another person is asking, Daktari, I had my fellow men discussing an issue, and they were talking about their women. They are saying that I can't fail to have a woman at bed. I better go away, because they were saying that this might it might lead me getting prostate cancer. Is this a myth, or is he talking something that is real, that if you fail to have yani ukikosa kufanya kitendo ya doa kwa muda fulani utapata hii prostate cancer?
No, I think that's a myth. That's a myth. Prostate cancer is not related to abstinence, sexual abstinence. Yes. Yeah. That's a myth. That's a myth.
So
It's not true.
It's not true. So that can cause cancer. Okay.
No, it's not true that sexual abstinence predisposes one to development of cancer of the prostate. Yeah.
Okay. Let me look at another question. Another person is saying, I'm single from the age of 20. I was in a relationship with a person, but the person broke my heart. I'm now a man of 45 years. I'm not yet married, and I'm scared of getting prostate cancer, because I hear that this is being abstaining is one of the causes. I think you've answered this question. You've said that be it that you're married, be it that you're not married, you can't get cancer.
Of course, there's something maybe I would want to say in regard to that. There are some types of cancers that are associated with sexual exposure. But this tends to be seen more in women. Like the cancer of the cervix is associated with early exposure to sex.
Early exposure.
Early exposure, usually early sexual debut. When girls are small, they are very naive. They may not be able to negotiate for safe sex. So they may have unprotected sex, and that can expose them to infection with a virus, the human papilloma virus, which has been associated with cancer of the cervix. Actually, in most cases of cancer of the cervix, we've been able to demonstrate the human papilloma virus. Yes.
Human papilloma virus.
Yeah, human papilloma virus. Of course, we can be able to understand how probably how this comes about, because viruses are particles. And they use the cell. They lack some of the body cell. They lack some of basic metabolic systems within them.
The way they make their food or what?
Yeah, they are dependent. So, like a virus penetrates a host cell, and then it uses the host system, the host cell system, to produce its own proteins, to process its own, to multiply, and also to produce its own viral proteins. So a virus cannot be able to multiply by itself. So when it comes into the cell, literally it hijacks the cell processes, so that now it commandeers the cell to produce what it needs, not what the host cell needs, but what the virus needs.
So you mean that when a person gets that infection, so the virus, the infection, the virus inside shall trigger your body to start producing more and more cells. So there's mass
abnormal cells.
Abnormal cells.
And it is some of these abnormal cells that lead to development of cancer. As I said, the cell loses, the body loses control over the cell because it has been invaded by the virus. So the viral genome or DNA is inserted into the host cell DNA. And we know that the nucleus where we have the DNA is actually like the control house. So when the control house is taken over by viral DNA, now the host cell starts behaving like the virus because now it only expresses viral signals. Yes.
Wow.
So the cell now ends up producing abnormal proteins. Now it is some of these things that lead to the development of cancer of the cervix.
Okay. I have a question here, and this person is saying, actually, it's a question. The person is asking, Daktari, I have developed a lump on my head. Can this be a sign of cancer?
Well, in life we say common things occur commonly. So probably there are lots of information we may want to have concerning that lump on the head for us to start thinking whether it could be cancer or not.
So it needs some tests.
Not tests. Some of these things you just need to go to the hospital to see a doctor who will be able to advise you. Like, for how long has he had this lump? Was he hit on the head? So in a forum like this one, the best thing to do is to advise them to go to a doctor to be advised.
To be advised.
Yes.
Okay, thank you very much, Jeremiah, for your question. And I think you've gotten the answer from Daktari. It's good you go see a doctor so that you can be advised. Thank you very much. The other person was about whether, because you're not married for, I think, 25 years now, between 20 years and 45 years, that is a difference of 25 years. You've gotten your answer. Thank you very much. Keep sending your comments on the numbers on the screen, and your questions shall be much answered, and we'll appreciate your viewership and your questions and your comments. As we wind up this discussion of today, I'd like you, Daktari, to tell our viewers one or two, three things about cancer, and maybe you can give your final remarks.
It is very important. I know a lot of fear has been generated among the public concerning cancer. But one thing about cancer is that cancer is curable. Cancer is curable. Cancer can be easily diagnosed. And in this country, cancer is treatable.
Cancer is treatable.
Yes.
Now, before you wind up, Doctor, you've said that cancer is curable.
Yes.
I had another person saying that you get cancer, you won't get cured.
That's not true. But probably there is some truth. But what I would like to say that whether cancer is curable or not depends with the stage at which the diagnosis is made. As I said earlier in the course of our discussion, is that most of the time cancer diagnosis is done very late, when the cancer has already spread and is already affecting other vital organs in the body. It becomes very difficult and tricky to manage cancer that is has already spread. But when cancer is diagnosed early, it is treatable and it is curable. Yeah.
Now, if because I know there are some people who are watching there and they might be that they might be some of the people have been affected by cancer, and maybe they are in a certain stage. What advice could you give to such kind of viewers?
I think it is very important that it should be established whether it is cancer, because there are many other conditions that can present like cancer, yet they are not cancer.
They're not cancer.
Yeah, not all body lumps or masses are necessarily cancer. So one, it is good to seek professional opinion, a professional opinion on that. Two, it is important that they follow the doctor's advice. Yeah. Yes.
And if I can ask you, how can you advise, which is the best place can you advise a person to go and have a test? Is it a public hospital, or is it a private hospital?
It all depends on what somebody is looking at. One thing I believe is that the practitioners in private practice and in public, they're equally qualified. But of course, in the public, of course, there will be many people. So sometimes probably one may spend more time before they are attended to.
Yeah.
In the private sector, of course, there may be fewer patients, so they are likely to get the results early, to be attended to by the doctor, also within a short time. But also there is the cost aspect. The charges are likely to be slightly higher than in because in public the cost is subsidized. Yeah, the government chips in and offsets some of the cost.
Yeah.
Okay.
Thank you very much, Dr. for coming.
Yeah.
And before you go, because I know we are going to have you in our next show, I'd like you to just say 2 or 3 words, zikienda sana, forwards to my viewer.
Well, cancer is a reality in this country, but however, it can be diagnosed very easily, and it is also treatable.
So treatable.
Yes.
Thank you very much. Thank you, viewers, for watching our program. That is My Health, My Gold. I know that you've benefited wherever you are in our country, Kenya, be it from the county of Mombasa. I know you're watching us from there. Be it from Nakuru County, you're watching us there, from the county of Kisumu, from Ukambani, and so many other places that you're watching us from. Don't forget, next time we'll keep on expounding more on different types of cancer. For example, we'll talk about breast cancer, we'll talk about cervical cancer, and some other types of cancer. Maybe you are there, you might be doing something that might lead to cancer. We'll come and we'll keep on informing you, educating you on the major causes of maybe a certain type of a cancer, and you'll be informed and educated. I've been your host, John Gao, in your program, My Health, My Gold. Don't forget, afya yako ni dhahabu yako. Until next time, I'd like you to keep tuned to other programs that are going to come to your favorite station, that is Mother and Child TV. See you next time, same place, same station. Keep tuned.
Indeed, my health is my gold. Only on Mother and Child TV.